In today's video, we're going to talk about the dangers of breast implants and some recent research that I think if you are contemplating breast implants or currently have implants in and are plagued with a whole assortment of symptoms, diagnoses, autoimmunity, hormone challenges, detoxification issues, this video is one you will not want to miss. Stay tuned for some really insightful information that will directly impact your health. Welcome, ladies. I'm Dr. Melissa Gallagher, and I am a naturopathic physician. I also am a lymphatic drainage therapist, and I work with a ton of women who are undergoing an assortment of breast-related surgeries, from implant, post-implant recovery surgery to explant surgeries to mastectomy, breast cancer surgeries. The whole gamut of plastic-related surgery and breast tissue surgeries are in my scope of healing, as well as work within my patient community. For any of you who might be investigating ways to heal your body and you might be dealing with implants that you aren't sure if they're actually impacting your health. And that's a big question. That's actually one of the reasons why I created about a year ago a video that I'll link right there about breast implant illness. It is an actual disease category, and there are some pretty amazing findings that certain breast implants and the manufacturers have some responsibility in the development of breast cancer. So that video that I created a year ago was a huge hit for a lot of women contemplating surgery, explant surgery. And I've been so inspired by so many comments and emails and messages from ladies who have watched that video. I wanted to go back in and update you about what's going on. And I think the research that's recently come out is significant because a year later, now we have more scientific evidence showcasing the dangers of breast implants and the higher or greater propensity to developing autoimmunity. Earlier this month, there was research that came out of the University of Alberta that stated that 1 in 4 implantation patients is at risk of a serious autoimmune disorder. That's 25%. That is a serious risk factor. So if you are dealing with Hashimoto's diagnosis, lupus, rheumatoid arthritis, Sjogren's disease, MS, infertility, hormonal imbalances, inflammation, swelling. What's kind of crazy about this study is it showcases and digs into the risk of women who have implants and the likelihood or risk factor of them developing autoimmunity. The risk factor alone is 45%. Oh my gosh. If you are out there and you have implants and you aren't sure what to do, I'm going to provide some links down below, and I'd encourage you to watch that first video because I think it's so impactful. Another study that I think is noteworthy, even though it's not recent, that has a huge impact on this discussion of today's video is in 2011, the FDA issued a safety communication regarding the link between breast implants and anaplastic large cell lymphoma, a rare type of lymphoma, and it's a cancer of the lymphatic system. So as a lymphatic therapist, that was on my radar screen way long ago. And one of the reasons why I've really dug into helping women manage the post-surgical effect of breast implants, but also to help spread the word and educate women that this might not be the best solution if you are already prone to autoimmunity or if you have any type of risk factors or family history or methylation challenges. And if you aren't sure what that is, shoot me a comment down below if you want me to dig more into some of the testing and some of the things that I look at with my breast implant patients. My intention with this video is to give you additional information and to keep you informed and updated with some of the latest research that continues to come out. One of the things that I think we will continue to see more information like that previous study I mentioned. I think it's really important that we stay tuned in, and I promise all of you viewers that I will keep you abreast of the situation and research as I see it cross my desk and into the lives of my patients and all of you viewers. Now, I want to give you some tips. It's always really important for me to make sure that you can take away something in my videos. If you're dealing with any type of degree of inflammation or rejection, if you're dealing with any capsular encapsulation or any type of difficulty with scarring or just inflammation underneath the armpit, lymph nodes that are really invigorated, I wanted to give you some tools that you can utilize, with the caveat that the best solution is to fully remove the full capsule and the implant. Really, an implant's a prosthetic. And so if you think about it that way, it's a foreign object, a foreign substance that we put in the body. that silicone lining is often what causes the body to fully go into an autoimmune attack. Because of that, autoimmunity and just the foreign substance, the prosthetic placed in the breast tissue, the body and the lymphatic system respond. So it becomes really important that you motivate your lymphatics to help minimize the fluid burden and the lymphatic burden of your body attacking that particular prosthetic, but it also becomes important that you move the lymphatics. So you want to always make sure, all you ladies, you want to grab a dry skin bristle brush, and I will put a link down below to purchase one of those on Amazon, super easy. And then this is another recommendation that I have. This is a homeopathic topical swelling pain reducer that helps minimize inflammation and move your lymphatics. Obviously, the most important part is to get that object out of the body, but if you can't for the time being, at least keeping your lymphatics open and moving will help them detox that tissue as much as you can. It is not uncommon for me to have women complain about pain, twinging, lightning strike pains, even more greater development of fibrotic or cystic tissue in the breast. So I actually recommend a CBD infused tea. I'll include a link for this. It's a CBD turmeric and ginger tea. It comes in this little orange box. This is really helpful for reducing the inflammation and the pain. And you can take this at night, it calms the body. One of the other things that we want to be really cautious of with implants is minimizing the impact on your adrenal glands and your neurotransmitters. By helping to balance your endocrine system through the use of a water-soluble CBD like this, that can help us at least minimize and offset some of the burden on their neurotransmitters. I actually do neurotransmitter testing like this. These are test kits that I have in my clinic, and I test all my post-explanters to help us minimize the impact on the neurotransmitters. And then I also do the adrenal stress testing. In conjunction with the dry skin brushing and the use of the tea tree oil, I actually like to recommend the Happy Breast Balm. This, you may have seen me comment and recommend this. I actually use this every day. I think it is important that we use good skincare and good breast health by supporting topically nutrients, driving nutrients into the breast tissue. One of the things that I like about this breast balm, first of all, it's made and manufactured in Australia. It ships internationally to you, super easy to purchase. I'll include a link down below. What I love about the breast balm, it has super clean ingredients. It has frankincense oil. It has fractionated coconut oil. It has a whole bunch of aromatherapy and essential oils that is very good for healing the breast tissue and minimizing cysts and fluid retention. But it also has something that we don't really talk a lot about in our breast tissue, which is the receptivity of the breast tissue to iodine. And this has the Lugol solution of iodine, which is really important in helping your breast detoxify and support the breast immune system from, guess what? A prosthetic like a breast implant. So ladies, I hope this information was impactful. I wanted to give you a little bit of some new clinical information, as well as some tactical and real world tools and resources that you can implement today in your life. If you have any questions, if I can be a resource, please comment down below, email me, check out my website. And also I'm going to encourage you to check out the Facebook page that Nicole has created. I've watched her grow this page and community, and it's phenomenal. And if you are considering or contemplating a breast explant, this page is going to be really helpful. So ladies, thanks for tuning in. If you are new, welcome. I hope you'll subscribe. And if you feel so inclined, I'm going to invite you to my community membership program here at YouTube. So I'll include a little detail there for you to check that out. Link in the bio as well. So thanks, ladies. I hope you have a wonderful holiday, and stay tuned for videos every day during Healthy Vlogmas. Have a great one.